My name is Dr. Tara Winters, physical therapist at Anderson Sport and Wellness. Today for our March Madness exercise, I'm going to be demonstrating a kneeling hip flexor stretch with your arms overhead. So if you work at a desk, if you've been sitting a lot, if you're traveling where you're having to be on a plane for a long time, if you're active in any way whatsoever, this is the stretch for you. It feels so good. So how we're starting with this stretch is you're going to be in a lunge position. Now, if you have knee pain or problems, you can roll up your mat a few times and it'll give you a little bit of cushion on your knee. So now it's a little more padding for my knee, or you can use a pillow. So otherwise, we are going to be in a half lunge position. So knee is resting down on the mat. You can have your foot up like that if that feels better for your knee, or flat. Now, before we start to move into the stretch, the most important thing here is to post your pelvic tilt so you're flattening your low back. If you don't understand that motion, you can start by arching your back. Usually that's one that we can get down pretty easily. And then you're reversing that, so tucking the pelvis in. And then you're having a pretty wide lunge here. Knee should be at about a 90-degree angle in the front. And all you're doing is leaning your body forward. So my hips are translating forward to create a stretch along the front of my leg. If this is painful at all, don't push. It should just be a mild to moderate stretch. If you're doing this in the morning or before activity, do this as more of a dynamic stretch. So what that means is you go into the stretch and you hold for about 5 seconds breathing and then rocking out of that. And you can do it between 5 and 10 times. So just rocking in and out. So today we're gonna add a little bit of arm movement to target our psoas more. So psoas is our deep hip flexor muscle that attaches to our low back. It can contribute to low back symptoms, pain, and a lot of times it just gets tight, as I said, with a lot of sitting. So what you're gonna do is bring your arms up overhead. In this case, on my right side, I'm gonna deviate toward my left, and my left hand is grabbing my right wrist to draw myself over and back. So I'm going into more of a diagonal here, and I feel the stretch along my stomach. I'll show you from a front view here. So we're here. Again, my right leg is the one that's stretched. I post your pelvic tilt, I lean forward, and then arm is gonna go up and back toward that left side of the room. Breathing into the stretch. It feels so good, nice and deep. We're not hyperextending at the back too much. And then come down. So this is how you can do it dynamically. Just come up, hold for about 5 seconds, and then come down. And then you'll switch sides. You can also just hold in this stretch for 30 seconds to a minute if that feels